Peter Rabinowitz is the director of the UW Center for One Health Research, and he joins us live now. Good morning, Doctor.
Good morning.
Thank you so much for joining us. So you are the principal investigator for this study. How many dogs tested positive, and what does this tell us about COVID and transmission between people and people and animals?
So as you said, we've been doing the study since last year, and we've sampled at this point close to 50 households where there's a COVID positive person in the household, and they have pets. And we were thinking right from the beginning that in places like Washington State, Seattle, people love their animals, and there would be a lot of contact between people and pets. And we also know that the SARS coronavirus 2, the virus that causes COVID-19, is originally an animal virus. We think it jumped from animals to people, and so it has certainly been reported elsewhere that it could infect other animals like dogs and cats. So we've been sampling these households, and we had done blood tests for antibody to infection in the dogs. And it took a while. We had we worked with the Washington State University Animal Diagnostic Laboratory to develop a new test for antibodies in the dogs, and we've just gotten confirmation of those tests. And it turns out that out of those 50 or so households we've been in with dogs, we've had 23 positive dogs so far. So it's showing that there's a lot of transmission happening between people infecting their dogs in the household. And when we asked people what they were doing with their dogs, a lot of them are sleeping in the bed with the dog, they're kissing their dog. And we are certainly recommending that at the moment people who are infected or think they're infected should social distance from their dogs as well, and probably hold off kissing and sleeping in bed until people aren't infectious anymore. And so far, by the way, we have also sampled the dog for the PCR test to see if they are shedding virus, and we have not seen that yet. So we have no evidence that the dogs are causing a risk to their owners, but we're certainly seeing that the owners are able to infect their pets.
How about the dogs, Doctor? Do the dogs get very sick in these cases?
Well, I'm a human doctor, not a veterinarian, but when we ask, but we are doing this study with veterinarians and doctors working together. And when we ask the owners about their dogs, a good proportion of them do say that the dog was sick, that the dog was not as active, had sort of runny nose, or the different ways that dogs can show COVID. So we think that a lot of the dogs are getting sick, and we would definitely, and we're hoping that more people continue to enroll in the study, and we can look even earlier at when the dogs are just starting to get sick and see if by any chance they are shedding virus, and just learn more about their illness and what it means for the whole household.
Dr. Rabinowitz, just real quick, you were one of the first people that we talked to on the show when the pandemic first started. And at the time, I remember Gee asking you, how worried are you? And you were up there in the 8s and the 9s. Where are you today?
Well, I think we are at this corner turning point, as you have heard, that we've got the vaccines, but if you look globally, we're still in a time of real concern. So I think that as a global problem, we have a long way to go. There are many countries that have not been able to really roll out the vaccine anywhere near what the United States and some other countries are doing. And as long as there are people around the world who are not vaccinated, who are susceptible, who could still get it, this vaccine is going to continue to spread every time we let our guard down. And that's a tall order. We've got to get the world immune, because the virus popping up anywhere in the world is a problem for the whole world. So we can't just say, oh, we've taken care of the United States, we're good, because we've seen in other places and in the United States that as long as infection is going on, you have a chance of more mutations, and those mutations have potential to not be as well covered by the vaccine and be potentially more transmissible or more virulent. So we're not done until we're done, and it's unfortunately not just something we take care of in our own backyard. We have to think about the whole world, because the virus is showing us how connected we are, and animals are part of that world, and that's the one health idea, that we have to look at the health of the animals as well as people. We've seen that in mink farms, where the virus has jumped from people into minks and then back to the workers again, sometimes with mutations. So we have to keep working both for humans and for animal health in this ongoing struggle.
Absolutely. Dr. Peter Rabinowitz with the UW Center for One Health Research, we appreciate your time. Thank you so much.